Today is Megan's first day trying XHANCE. Glad you're here for it. You see that? You blow instead of sniff. That's easy enough, right? Let's take a closer look at how to use XHANCE. A mouthpiece? Well, that's different, and for good reason. Chronic sinusitis is caused by inflamed tissue high and deep in the nasal passages where sinuses drain. It can be hard to get medication that high and that deep. XHANCE is a different kind of nasal spray. You blow and don't sniff. With XHANCE, your breath helps deliver medicine high and deep into your nasal passages to areas of inflamed tissue where chronic sinusitis typically occurs. This may give you the relief you're seeking. Getting XHANCE ready is easy. Before you use a new XHANCE for the first time, you have to prime it. First, remove the cap, then give the device a good shake. There you go. Next, pump the bottle 7 times or until you see a fine mist. Look at that mist. Yeah, you can stop now. After priming XHANCE for the first time, you do not need to prime it again. If, however, you have not used XHANCE for 7 or more days, reprime XHANCE by spraying 2 times. Now, let's see how to use XHANCE. It is important to remember to shake XHANCE before each use. Also, ensure you have the correct grip. Using 1 or 2 hands, place your fingers on the indented grip below the flexible mouthpiece. Oh, no. Where's that finger going? You want to keep it below the mouthpiece. There you go. Now you're ready. Step 1. Seal. Gently insert the nosepiece as far into your nose as is comfortable and the flexible mouthpiece into your mouth. Don't worry, it's okay to bend the flexible mouthpiece. It's important to make sure you get a good seal between the nosepiece and your nostril. Step 2. Aim. Aim the device upward between your eyes, which will help the medicine go high and deep into your nose. It may help to use a mirror for the first couple of times. A little more to the left. Not quite that much. Now, that's the spot right there. Well done. Step 3. Blow. Take a deep breath, then blow hard into the mouthpiece as if you're blowing up a balloon. You will feel resistance until you press the bottle. Step 4. Press. And now, while still blowing, press the bottle with your thumb. This will release the medicine. XHANCE is designed to deliver medicine high and deep into your nasal passages to inflamed areas where chronic sinusitis typically occurs. By blowing into XHANCE, it closes your soft palate and helps prevent the medicine from going down your throat. That's part of what makes the exhalation delivery of XHANCE so different. Make sure to keep blowing when you press the bottle to help make the medicine go high and deep into your nose. Do not try to sniff or block the other nostril. That's a no-no. If you have a good seal and aim between the eyes, the air should go out the opposite nostril when you blow and press. Now, repeat these steps for your other nostril. Remember to use XHANCE twice daily. Let's bring it all together, shall we? Seal, aim, blow, press. It's that simple. Want more step-by-step details? Review the full instructions for use. Just like Megan, more and more patients are discovering XHANCE and experiencing a medicine that goes high and deep into the nasal passages. Now, it's your turn. XHANCE is a prescription medicine used to treat chronic rhinosinusitis with or without nasal polyps in adults. It is not known if XHANCE is safe and effective in children. Do not use XHANCE if you are allergic to fluticasone propionate or any of the ingredients in XHANCE. Get emergency medical care if you get any of these signs of a serious allergic reaction: rash, hives, swelling of your face, mouth and tongue, breathing problems, or low blood pressure. XHANCE can cause nasal problems such as nosebleeds, crusting, sores, hole in the septum, and slow wound healing. You should not use XHANCE until your nose is healed if you have a sore on your nose, have had surgery on your nose, or if your nose is injured. XHANCE can cause eye problems including glaucoma and cataracts. You should have regular eye exams when using XHANCE. Call your doctor if you have vision changes while using XHANCE. XHANCE may increase the risk of infections and can make certain infections worse. Avoid contact with people who have a contagious disease such as chickenpox or measles while using XHANCE. XHANCE can cause reduced production of steroid hormones by your adrenal gland, resulting in tiredness, weakness, nausea and vomiting, and low blood pressure. XHANCE can weaken bones. Osteoporosis. The most common side effects include nosebleeds, sores, ulcers in your nose, pain or swelling of your nose or throat, redness in your nose, nasal congestion, sinus infection, and headache. Tell your healthcare provider about all your medical conditions and medications that you take. It is especially important to mention if you take antifungal or anti-HIV medicines, as they may interact with XHANCE. These are not all the side effects of XHANCE. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. Please see accompanying patient information and instructions for use.